Hi, my name is Samantha Duell. I am the program specialist for the Caregiver program with long-term services and supports. Today we're going to talk about the Caregiver program across the state of South Dakota. The purpose of the Caregiver program is to relieve and assist caregivers by providing services which may help ease the burden of caregiving. Families are the backbone of long-term care for older persons in the United States and South Dakota. In the United States, there are more than 52 million caregivers who provide care to adults aged 18 years and older with a disability or illness. There are 43.5 million adult family caregivers who provide care for someone aged 50 years of age and older, and 14.9 million care for someone who has Alzheimer's disease or dementia. These caregivers include spouses, adult children, and other relatives and friends. Surveys of family caregivers have shown that they wish they had known more about how to provide care, about the resources that exist, how to get help for loved ones and themselves, and what they can do to be sure that their quality of life is optimal. Many family caregivers have said that future caregivers need to have the opportunities to understand caregiving and its dimensions ahead of time in order to be prepared for the challenges that may arise. Caregiver support programs are essential in providing family caregivers with the support services that they need to fulfill the roles of being cared for loved ones. The goal of these caregiver support programs are to ensure caregivers to have access to services in order to sustain and support caregivers as they strive to meet the needs of their care receivers. The Caregiver program stems from the Older Americans Act, which was the first federally funded level initiative aimed at providing comprehensive services for older adults. Older Americans Act provides funding based primarily on the percentage of an area's population aged 60 and older for nutrition and supportive home and community-based services, disease prevention, health promotion services, elder rights programs, the National Family Caregiver Support Program. The OAA also includes community service employment for low-income older Americans, training, research, and demonstration activities in the field of aging, and vulnerable elder rights program activities. Today, the OAA is considered to be the major vehicle for the organization and delivery of social and nutrition services to older individuals and their caregivers. The OAA of 2000 was amended on November 13, 2000 to include the National Family Caregiver Support Program, which provides grants to states and territories based on population aged 60 and over. The National Caregiver Support Program is intended to help family members who are struggling to care for their older loved ones who are ill or have become disabled. Provides systems of support services for family caregivers, including grandparents or older individuals who provide care for relatives. These services also provide support to grandparents and any other non-parent relatives who are the primary caregiver of children under the age of 18. The services available through the Caregiver program are listed here, and we will go into these services in detail later in this presentation. When persons are eligible for other services, the caregiver services may be considered after considering the other available services, sort of like a last resort. The caregiver program may not be used to provide a break to a professionally paid caregiver, meaning that they can get paid to go to work. There are many benefits to the caregiver program. Families are the major provider of long-term care, but research has shown that caregivers take a heavy emotional, physical, and financial toll. Many caregivers who work and provide care experience conflicts between these responsibilities. According to the Administration on Aging, 22% of caregivers are assisting 2 individuals, while 8% are caring for 3 or more. Almost half of all caregivers are aged 50 and over, making them more vulnerable to a declining in their own health and 1/3 described their own health as fair to poor. However, studies have shown that caregiver services can reduce caregiver depression, anxiety, and stress, and enable them to provide care, thereby avoiding or delaying the need for institutionalized care. 77% of caregivers report that services definitely enable them to provide care longer than otherwise would have been possible on their own. 89% reported that services help them to be a better caregiver. As you can see, the Caregiver program is highly beneficial for the mental health and physical health of the caregiver. On the next 4 slides, we will walk through the 4 different eligibility groups for the caregiver services. This one is for caregiver recipients over the age of 60. Eligibility means that an adult family member aged 18 or over and other adult informal caregivers provide care to frail individuals aged 60 and over. Alzheimer's care recipients basically has the same thing. Care recipients over 60, the services that are available are also listed on this slide. Care management, respite, information and assistance, supplemental services, training, counseling, homemaker services, as well as nursing services. This last section for care recipients under 60 is unique in that this program was in existence in South Dakota prior to the National Caregiver Support Program being funded by the federal government. For that reason, the eligibility and services look slightly different. The grandparent program is for grandparents or other relatives aged 55 and older who are caring for children under the age of 18, whether they are a relative or not. Some of the services that are included in this could be environmental services to help bring the children into their homes if they're not ready for them to come in, as well as respite care. This slide just continues on with what services are available for grandparent caregivers over the age of 55. Some definitions that are also found in the policy manual. Definition of a grandparent or an older individual. We will now move into discussing the Family Caregiver Support Program in South Dakota and the services that are provided. First is respite. We will discuss in respite care, which includes adult day, in-home respite, and institutionalized respite. Adult day is an organized program outside of the home. Services are supervised and include social and/or health care for elders who require services that are skilled or physical assistance with activities of daily living. In-home respite services provided in the caregiver or care receiver's home setting on a short-term basis due to absence or need for relief for the primary caregiver. Institutionalized respite. These services are provided on a short-term basis in a residential or assisted living facility, nursing home, or other institution due to the absence or need for the relief of the primary caregiver. Long-term services and supports provide case management, which provides assistance with accessing services and/or coordination. Activities of these case management include assessing needs, developing care plans, and authorizing services, arranging services, coordinating the provision of services among providers, follow-up, and reassessment. LTSS may assist individuals to set up services, make arrangements, regardless of whether or not the services are being paid by the program. Coordinating appointments, etc. can be a difficult and busy task for a busy caregiver. So it can be helpful to have assistance, even if the caregiver pays entirely for the services on their own. Information and assistance is a service for caregivers that provide information on resources and services available within their communities and assist caregivers in obtaining access to these services and resources. This service includes providing individuals with information on services available, linking individuals to those services and opportunities, and establishing adequate follow-up procedures. Supplemental services are items and services that complete and assist the care provided by caregivers, secure a safer environment, and ease the burden of providing this care based on each caregiver's needs and situation. Supplemental services is a broad service which covers a lot of areas. The first service is assisted devices, home modification, and repairs. Assisted devices are devices that enable an individual to perform routine personal tasks independently or which provide for a safe, secure, and accessible environment related to healthcare needs. Home modifications include a modification to a home that increases ease of use, safety, comfort, security, and independence, and helps ease the burden on the caregiver. Chore services are non-continuous household maintenance tasks intended to relieve the caregiver of tasks necessary to maintain the residence. Repairing windows, such as screens and storm windows, weather stripping around doors, window shades and curtain rods. Heavy housework, such as washing walls and windows, pest control, yard work, such as grass cutting, leaf raking, trimming overhanging branches, sidewalk maintenance, such as clearing of snow and ice. Emergency response system is a safety device for individuals who have significant health risks. It is a simple electronic device that the person wears, usually around their neck, on a necklace, or as a wristband. In the event of a fall or an emergency, they can push the button, which will activate a telephone alert system. A central operating location then makes contact with a designated friend or family, or if necessary, ambulance for assistance. ERS helps seniors maintain their independence while remaining at home. Examine a condition, symptom, ability of environment in the areas of driving, psychological, nutritional, health, cognitive, health, safety, financial, speech, hearing, functional, or diagnostic. Medical equipment are devices made to help diagnose, monitor, and treat medical conditions. Medical supplies include supplies for incontinence and diabetes. Supplemental services, meals for caregivers that are nutritional supplements. If eligible, the caregiver should be able to get a meal in their home. Please refer to the nutritional director if a nutrition program is available in that area. LTSS staff are available to come and talk to groups regarding services under the Caregiver program. LTSS specialists can help the caregiver assess their needs and develop a plan to provide some relief from the burdens of caregiving. Something as simple as having an hour or two free to attend a movie with a friend can make the world of difference. Homemaker and nursing services are available under the Caregiver program, but are typically made available through other programs first. We have a list of guidelines to help clarify the program. Income. The OAA, Older Americans Act, states that we cannot have income requirements for family caregiver support programs. The state's pre-existing respite care program has income guidelines which can affect eligibility. Multiple caregivers and/or receivers. The primary caregiver will be identified by the amount of time spent with the care receiver. Donations. There is no fee for the program with the exception of the under the 60 respite program, but caregivers are given the opportunity to donate to this program on a free will basis. Determination and authorization of caregiver amount. The allocated amount for caregivers to spend will be based on specific identified needs of the caregiver through the caregiver assessment and the agreement for caregiver services budget worksheet. Identification of providers. Caregivers may choose their own care provider. They might be family members, neighbors, friends, family acquaintances, community resources, or agencies. It is important to select a provider that is in the best interest of everyone involved in the situation, including the caregiver. Some limitations. The care provider may not live with the care recipient. The care provider must be at least 18 years of age or older. The provider is trained and qualified to provide the care that is needed for the care recipient, and that there have been no substantial allegations of abuse, neglect, and/or exploitation by the provider requesting reimbursement. Make sure to remember that the caregiver program should not be primary when persons are eligible for other caregiver services. The caregiver program can be used if these other resources have all been exhausted. The intent of this program is to provide support to the caregiver. It is not designed to be an employment opportunity for the provider. The provider cannot be an employee of the state, and the state does not withhold Social Security or income tax. The individual is self-employed and must declare their earnings and pay Social Security accordingly. A 1099 form will be issued by the state to all providers receiving more than $600 during a calendar year. The department may discontinue services if the resources are exhausted, the individual can no longer benefit from services, or the individual or provider's health or safety is in jeopardy. We will go through a series of scenarios. Melanie is a caregiver for her mother, Betty. Betty is 90 years old and has Alzheimer's disease, shortness of breath, uses oxygen at night, and has had heart and kidney problems. Melanie does all the cooking, cleaning, laundry, medication administration, helps Betty get dressed, and transportation. Betty resists if Melanie tries to help her bathe, so Melanie requests to have an aide come into the home 1 hour a week to bathe Dorothy. Is this a service that can be provided under the caregiver program? Yes, Betty has Alzheimer's disease and other health issues. Melanie is a caregiver and does extensive housework, transportation, etc., and needs assistance with bathing. In the case, an agency might be selected and the caregiver experience with bathing assistance will be assigned to come in and help with bathing. This relieves Melanie of a stressful encounter and still allows Betty to maintain her personal hygiene with the help of a professional aide. Scenario 2. Teresa moved here from California to care for her mother who has severe dementia. Teresa is looking for approximately 10 hours per week of caregiver services to watch her mother, usually on Friday and Saturday evenings. She is looking for help from around 7 p.m. to midnight on both nights. Teresa helps out the Salvation Army when there are musical programs. She wants to find a private person and pay them $10 an hour for care. Yes, again, this is a good opportunity for the daughter Teresa to enjoy a respite from her full-time caregiver role and assure her mother's safety. Scenario 3. Can the caregiver program purchase a treadmill for an older gentleman who had lung cancer? He was just released from the hospital with pneumonia, but his doctor recommended that he take walks. The answer for this one is no. Unfortunately, this service is not available with caregiver funding because no caregiver has been identified. Other resources should be explored with long-term services and support specialists. Number 4. A caregiver assessment was completed for an individual named Lori, who is age 58 and has diabetes. She is looking for caregiver services to help her with her son Graham. Graham is a 30-year-old who has cerebral palsy, has had a stroke, and uses a wheelchair. Graham cannot be left alone for any amount of time. Lori is requesting someone to sit with Graham when she goes in for her own regular checkups with her doctor. The answer is yes. This is a good example of the different qualifications within the caregiver program. The care recipient in this scenario is under the age of 60, so the caregiver is eligible for respite services under the Respite Care Act. Number 5. Roger is caregiver for his wife Elizabeth. Elizabeth had had a stroke and was in a nursing home for several months. She is wheelchair bound and needs assistance with all of her ADLs, except for eating. Roger and Elizabeth live at home and he provides care for her. Roger would like an agency to come in and help with cleaning for 2 hours weekly so he can go grocery shopping and run errands. Yes, this is a good example of services which can be provided to give the caregiver some relief and a break from his caregiving role. Thank you. If you have any questions, please do not hesitate to contact me as I will answer them to the best of my ability. Have a nice day.